Hello and welcome to the HCS 542 Masters in Health Administration competency-based presentation entitled Complexity Leadership. Within this presentation, I will examine the concepts of complexity and emergence, adaptability, and the challenges associated with implementing complexity leadership strategies within an organization in order to address as well as resolve healthcare challenges such as those related to changes in healthcare policy and shortages in workforce members. This presentation will further address the relevant complexity leadership principles of adaptability, being those of operational, entrepreneurial, and enabling leadership, as well as discuss the necessary strategies which I feel should be implemented in order to resolve the aforementioned healthcare challenges. To begin this presentation, it is critical to first understand and define what complexity is and better understand its connection to complexity leadership theory, the relevant strategies utilized within complexity leadership theory, as well as the impact that the complexity can have upon a system, an organization, and/or a process. Each day, we as individuals experience complexity within our daily lives, whether this includes personal interactions, those that may occur at work, or those that occur within our environment. Change is always occurring. The byproduct of unexpected outcomes within this change and how we respond to this change is known as emergence. Emergence occurs when an organization or an individual develops and implements new strategies or methods in order to meet changes within their environment. While complexity occurs within an innumerable number of processes, interactions, and occurrences, for the purpose of this discussion, this presentation will center on subsequent concepts of complexity, adaptability, and emergence, as well as their impact upon an organization and an industry, and the underlying factors and engagements that addressing these issues can have upon a healthcare organization. Complexity leadership theory is a leadership model that challenges and diverges from the conventional leadership belief that leadership must occur within a hierarchical top-down system. The framework of complexity leadership theory centers on the ideal and practice that processes within an organization's leadership can be successfully implemented within any point of the organization, regardless of the system of leadership in which it occurs. Complexity leadership relies on the combined efforts of the organization's ability to meaningfully develop effective emergent solutions in order to adapt to change, which is manifested by the organization's development of new and innovative approaches to organizational complexity. According to PubMed.gov, complexity leadership is a framework for enabling people and/or organizations for adaptability. It views leaders not as managerial implementers of top-down directives, but as collaborators who work together to enhance the overall adaptability and fitness of the system. From a collective complexity leadership perspective, the role of nurse leaders should not only be to help the system run, but also to help run it better, increasing organizational adaptability. Within complexity leadership, the initiation of principles of adaptability and leadership occur from a top-down as well as a bottom-up process in order to efficiently adapt and respond to emergence within a system. Further, the complexity leadership can lean heavily upon the idea and practice that an organization's leadership is the linchpin of effective adaptability strategies and initiatives, and further acts as a collaborative bridge to interorganizational teamwork and teamwork efforts. In order to address the relevant healthcare leadership challenges, it's critical to examine the relevant complexity leadership approaches which will serve to allow the organization to pivot in times of turbulence and upheaval and effectively make real-world application to its emergent strategies. According to the article, Complexity Leadership, a complex adaptive system is a dynamic system that is able to adapt and evolve within a changing environment. At a macro level, it is a collection of dynamic networks of interactions, with each network comprised of a collection of many agents acting in parallel, creating rich interconnectivity. In order to effectively adapt to the various changes and/or complexities which may occur, an organization's collective workforce must be aware of the leadership concepts contained within the organization's principles of adaptability. The complexity leadership principles of adaptability consist of the following three components: operational, entrepreneurial, and enabling leadership. Within the operational approach to adaptability, the organization develops the foundation for the formal construction of organizational design and aligns necessary processes and systems to effectively create ideals and further develop them into productive and useful components. Within the entrepreneurial principle of adaptability, the organization is able to develop new ideals, concepts, and innovations that will lead to more effective strategies. This stage is representative of the organization's ability to centralize its ideals and explore new concepts and/or strategies previously unexplored. The end result is organizational growth and emergence in response to complexity within the healthcare organization. Enabling leadership, the last but certainly not the least of the three principles of adaptability, is just as critical as its predecessors. Enabling leadership allows the space for the fostering of growth, the sharing of ideals, the exploration and testing of emergent ideals and strategies. This approach is vital towards the sustained growth, adaptability, as well as innovation within the healthcare organization. A relevant healthcare challenge that has emerged within the healthcare industry in recent years has been the emergence of a workforce shortage of qualified healthcare professionals that includes individuals such as doctors, nurses, pharmacists, and nursing assistants. With the significant growth and expansion of individuals in need of care, this shortage is particularly impactful to the healthcare industry that relies heavily on these healthcare professionals to provide quality care and services. Further, the healthcare industry has also been tasked with managing the increasing cost due to extremely competitive healthcare markets. The second healthcare leadership challenge that I address is that of changes within healthcare policy. Healthcare policy is continuously changing, and as such, an adaptive response to the relevant changes in healthcare policy is necessary in order to meet the state and federal regulatory requirements that ensure that health and safety are in line with the various requirements of regulatory oversight agencies and those of building and safety requirements. In order to address the healthcare leadership challenge associated with an industry workforce shortage, I would implement an enabling approach to complexity leadership. I feel that this approach best addresses the current work shortage due to the organization's need to develop and implement an immediate solution to its staff shortage. The enabling approach, I believe, works well within this healthcare challenge, as it is effective in amplifying an organization's efforts to leverage its workforce through its extensive utilization of the network of healthcare professionals and providers in order to meet the needs of the organization. Essentially, within this approach, the enabling approach, workforce members can be quickly moved to the areas of need. In order to address the identified healthcare leadership challenge associated with changes in healthcare policy, I would implement the adaptability approach of operational leadership. This approach, I feel, best addresses the organization's need to change its policies in order to remain in compliance with healthcare policies due to changes in healthcare law and regulation. I feel that the operational approach is the most appropriate strategy to implement within this healthcare challenge, as the operational approach allows for leaders to drive change while still acting within an accommodating role. Within this process, I feel that the organization's leadership further would be useful in aligning organizational processes with those already previously established, and will be effective in translating organizational changes in policy to the organization's workforce members while not disrupting the organization's current operations. Complexity leadership theory is a leadership model that challenges and diverges from the conventional belief that leadership must occur within a hierarchical, top-down leadership style in order to adapt and respond to changes within a healthcare organization, system, or market. The framework of complexity leadership theory centers on the ideal and practice that processes within an organization's leadership can be successfully initiated within any point of the organization, regardless of the system of leadership in which it occurs. Complexity leadership further relies on the combined efforts of the organization's ability to meaningfully develop effective emergent solutions in order to adapt to change, which is manifested by the organization's development of new and innovative approaches to organizational complexity. Within complexity leadership, the initiation of the principles of adaptability and leadership occur from a top-down as well as bottom-up process in order to efficiently adapt and respond to emergent changes within a system. Further, the principles of complexity leadership lean heavily on the ideal that leadership is the linchpin of effective adaptability strategies and initiatives, and further acts as a collaborative bridge to interorganizational teamwork and networking efforts. Lastly, the organization that utilizes the principle of complexity leadership recognizes that the organization's leadership is not seen as implementers of organizational directives, but as organizational components within a much larger system of cohesion and adaptability that is shared amongst each member within the healthcare organization. To conclude, healthcare complexity leadership, the initiation of principles of adaptability and leadership occur from a top-down as well as bottom-up process in order to efficiently adapt and respond to emergent changes within a system. The principles of complexity leadership lean heavily upon the ideal and practice that an organization's leadership is the linchpin of effective adaptability strategies and initiatives, and further acts as a collaborative bridge to interorganizational teamwork and efforts. Thank you for taking the time to listen to my presentation.